Friend who did some yard work over the weekend and now their back isn't feeling very good. I'm so glad Dr. Cimikoski is back on the show from Utah Stem Cells Joint Treatment and Wellness Center, and we are talking about those aches and pains and how stem cells can help. And we've heard of the benefits, but explain those to our viewers.
Well, Nisha, a lot of people have heard of stem cells and they know they're doing something pretty fantastic because there's a lot of media attention. People are hearing about stem cells being used to treat a variety of different conditions. We can treat spinal cord injuries, we can treat heart failure, we can even use it for wound healing on the skin, diabetic ulcers, burn victims. But the longest application for the use of stem cells is for the musculoskeletal ailments in the body. So there's an abundant amount of data and a long-standing history of excellent results of using stem cells to regrow cartilage, repair tendons and ligaments. And stem cells are cells that just lay dormant in your body that are just waiting to be told by the body what is injured, what needs to be repaired. It sends a signal to the stem cells come to that area, wherever it might be, bad knees, sore back, torn rotator cuffs, whatever that tissue is that's damaged, stem cells migrate to that area and become new healthy tissue.
They're healers. They're little healers
Yes.
in there. How do the treatments work? Are you injecting those stem cells in the area?
Well, initially we used to harvest the stem cells directly from the patient. We could take it from your bone marrow adipose tissue, and we had very good results with that. But now we can use both amniotic and umbilical cord stem cells. These come from a live, healthy birth, and they're much younger, more immature, more potent than your adult stem cell. So we take the stem cells, we get them from a bioengineering company that harvests them from a live, healthy birth. There's no aborted fetuses that are being used. That's where embryonic stem cells come from. But with the amniotic and umbilical cord stem cells, we take those stem cells, we mix it with your own platelets. We do a blood draw in the office. We call that platelet-rich plasma. And the two of those together, we inject right into the joints that are needed to heal. And by doing this, we're delivering thousands of times more stem cells than what your body will send in. Plus, it's a much more potent and better quality stem cells than your adult stem cell.
When do you notice a difference? When do you start feeling better?
Well, the nice thing is that there's no real downtime. It's about a 1-hour office procedure. You walk out of the office, you can get on with all your normal activities, but it takes about 5 to 6 weeks to get about 70 to 80% of the improvement. At 5 to 6 weeks, I see you back to do a reevaluation to see how you're doing. The stem cells will continue to heal up and regenerate up to 8 to 10 weeks later. But at the 5 to 6 week mark, you're getting a lot of the improvement by that time.
And I'm thinking that's about summertime, everybody.
Exactly,
so now's the time to talk about this. I understand you have a special promotion for our viewers.
Sure, absolutely. So if you call my office located in Sandy, we have a special promotion of $300 gift certificate that you can use towards your procedure and one for a family member as well.
And the best way to get a hold of you, all right there on the screen, everybody. The phone number is there. Also the website, utahstemcells.com. That's their website. We can link you from ours. Go to goodforutah.com/midday. All the information will be right there. Dr. Cimikoski, thank you so much.
Thanks for having me, Nisha.
Good to see you. Bri, back over to you.
All right, thank you, Nisha. Police are calling a shooting